while we talk about other treatment options, immunotherapy is something that previously was not an option for colorectal cancer, but now we now know that a subset of colorectal cancers, which are characterized by something called mismatch repair deficiency or microsatellite instability-high tumors, or the Lynch syndrome associated tumors. These are the tumors that do respond to immunotherapy, and immunotherapy is now approved for them. Not only single agent anti-PD-1 drugs, but also the combination of nivolumab and ipilimumab also is now something that is approved for patients with metastatic cancers who have at least failed the traditional 5-fluorouracil oxaliplatin irinotecan chemotherapy. Now, they unfortunately don't comprise the fair majority of colorectal cancer. At best, they're 4 or 5% in the stage 4 setting, but when it is present, it does make immunotherapy a very effective option. So by default, one thing that is an important advancement over the last few years is to check every single patient with colorectal cancer for mismatch repair deficiency or the microsatellite instability, because then immunotherapy is a very viable option for them.